This is a low power view of the posterior portion of the lower limb. For orientation, we show the greater trochanter and the position of the ischial tuberosity and the popliteal fossa. We incise the fascia lata in order to reveal the muscles of the posterior compartment of the thigh. We've incised the fascia lata, and we now reflect it in order to show the muscles of the posterior thigh. We re-identify the position of the greater trochanter, and we reflect the gluteus maximus muscle to show the ischial tuberosity, which is the origin of the hamstring muscles. Lateral to the ischial tuberosity, we identify the sciatic nerve, and arising from the ischial tuberosity, we identify the long head of the biceps muscle, the semitendinosus muscle, and the semimembranosus. In order to expose the sciatic nerve along its course on the posterior thigh, we prepare to incise the membrane between the semimembranosus muscle and the long head of the biceps. We now incise the membrane to reveal the sciatic nerve. We've exposed the sciatic nerve, and we can see its two divisions, the tibial nerve and the common peroneal or common fibular nerve. Laterally, we show the tensor fascia lata and the iliotibial tract. Just medially, we show the short head of the biceps femoris muscle, which arises from the shaft of the femur rather than the ischial tuberosity. If we follow the short head inferiorly, we see it joins the long head of the biceps. We identify the posterior femoral cutaneous nerve and the long head of the biceps femoris. We reflect these structures to show perforating branches of the deep femoral artery or profunda femoris. These vessels supply the posterior compartment of the thigh. In order to reveal structures of the deep posterior thigh, we've retracted the biceps muscle and the sciatic nerve laterally, and the semimembranosus and semitendinosus muscles medially. In the femoral triangle, the femoral vessels lie anterior to the femur. As they descend in the adductor canal, they lie medial to the femur. These vessels exit the adductor canal through the adductor hiatus to lie posterior to the femur. We show the fleshy portion of the adductor hiatus, and we show the large tendon, which extends inferiorly to attach to the medial femoral condyle. At this point, the femoral vessels become known as the popliteal vessels. We show the popliteal vein and the popliteal artery.